1 in 5 American adults, Montel, 1 in 5 experience a mental illness.
Yeah, and despite so many people suffering, mental health is still stigmatized. But guess what? Not today.
And here to open the conversation and get the facts out is Dr. Carney. She is Chief Medical Officer of Magellan RX Management. Welcome to the show, Dr. Carney.
Thank you so much for being here.
Thank you so much for having me and letting me spend some time talking about this important topic.
You know, with the stress and anxiety of COVID-19, there's an increase in the conversation surrounding mental health. Let's start with some of the misconceptions.
Well, the biggest misconception is that mental health isn't real. Mental health is no different than having, say, diabetes or heart disease. It comes about because of genetics, because of environmental stressors like COVID or other traumas. It comes about because of the way we're raised in our development, and it comes about because of our biology, the way that we're made. Mental illness and physical illness should never be looked at in a different way.
COVID-19 has created so much uncertainty with so many people and so much disappointment. What resources do you provide to help with these unfortunate issues?
Well, we started at Magellan very early on, compiling a lot of resources directed specifically at the emotional after effects of COVID and to help people learn how to deal with it, whether that was through coping with new symptoms, anxiety, depression, stress they might be having. Our library is abundantly full of information and is available to the public. We also do a series of webinars that reach out in a deeper fashion on things like grief that have been very helpful to individuals. We have a live Twitter that happens once a month with trained mental health professionals, so you can join in and ask your questions. These resources are available as well as others if you go to our website.
You know, throughout all of this, the senior population has been disproportionately affected by this, and you guys have been providing services to them, but how have you enhanced them since this COVID-19?
We have been reaching out to seniors to reach them where they live, whether that's in long-term care facilities or even if they're sheltering in place all alone. Loneliness is a predictor of chronic disease and a predictor of death. Our case managers are taking phone calls and also calling out to seniors to make sure that they stay connected with a live voice. That live voice, that human touch is more important now than ever.
Now let's talk about our heroes,
Yes.
First responders, nurses, doctors. They have been on the front lines. They are exhausted physically and mentally. What are you doing to help them as well, doctor?
We have a confidential line that first responders and healthcare providers can call in and talk to a professional trained in dealing with individuals exposed to trauma. Our average call time has been 20 minutes, so there is a need. So please, first responders and healthcare providers, use these services. They will help you.
How do we ensure a continuous conversation about mental health?
We need to work with our legislators to ensure that we continue to have funding for providers and for services like telemedicine to reach others. We need to talk openly about it, share our own stories, take the stigma away, and most of all, we need to have hope. Mental illness is treatable, and it is not something that is futile. We can make people better by providing the right kinds of services for them.
Thank you so much, Doctor, for being here and making sure you share this information to our viewers.
I really appreciate your time today. Keep up the great advocacy you both are doing.
Thank you, doctor. And by the way, to access the resources discussed today, visit magellanhealthcare.com/COVID-19.
And as always, for more information, you can go on our website, thebalancing.com. We'll be back right after this.